Welcome back. You're watching NDTV. The Prime Minister and the top leadership of the Congress Party were in Muzaffarnagar earlier this week to visit victims of communal violence. 50 people were killed in the riots in Muzaffarnagar. In another part of the state, just a few hours' drive away, 240 people, mostly children, have been killed in Gorakhpur in eastern UP. It's a story that's reported on year after year, and unfortunately, not much seems to have changed on the ground, and there aren't that many VIP visits. %33% of the children who come out alive affected by this deadly brain fever will be disabled permanently.
The writing on the wall is that this is a national medical emergency. Officials have told us the virus is spreading by around 20 to 30 kilometers every year.
Aditi is one of 23 children currently admitted here in the epidemic ward in the Gorakhpur hospital. For every family here, it's the same story. It started with a fever and then fits, and now all they can do is wait and hope for recovery. Hundreds die every year. Newspapers, TV channels report it annually, but nothing changes on the ground. Encephalitis in eastern UP, it seems, has almost become part of the general landscape. No one is spared. Travel to any village in this region and there are heartbreaking stories of death and young lives lost.
पहले उल्टी हुआ, माथ दर्द में, तो ले गए ग्लूकोज चढ़ल, ओकर बाद नहीं कंट्रोल भइल, तब माथ के पीड़ा तो कंट्रोल हो गई, ओकर बाद.
This year already, over 200 children have died. 800 more children and adults have been admitted here in the endemic ward of the Gorakhpur Medical College. The encephalitis virus is transferred by mosquitoes from pigs to humans. Stagnant water and a lack of hygiene only hastens its spread. It is preventable with a vaccine, but again this year, the vaccine has not been administered.
Today, the Principal Secretary Health, he has mentioned that we have enough number of vaccines today. But a couple of months ago, when we had a meeting at Delhi level, it was found that vaccines were not available. The civil societies, the public, they had complained to the Commission that the vaccines are not reaching in ample amount in the state of Uttar Pradesh. And that is one of the causes of death.
For 240 children this year, it's already too late. In 2006, the government launched the first mass vaccination program against encephalitis. Then again, nothing for 4 years. Finally, in 2010, a second round of the vaccination. In the interim, over 3,000 had died. In 2011, the Health Minister Ghulam Nabi Azad actually visited Gorakhpur. He announced over 20 crores for the building of a new wing at the hospital, especially for encephalitis patients. 2 years on, the building is still under construction. And this year, the district administration says the deaths are largely due to a new strain of the virus.
देखिए जो AES है ये बहुत ही इल डिफाइंड टर्म है, एक्यूज एन्सेफेलाइटिस सिंड्रोम. इसमें लोग ऐसा समझते हैं कि इसमें कोई एक वायरस रिस्पांसिबल है, जैसे कि जेई में अर्बो वायरस या फ्लेवी वायरस होता है. इसमें बहुत सारे वायरसेस होते हैं जिसके लिए रिस्पांसिबल होते हैं.
In any other country in the Western world, the death of over 200 children due to an epidemic would create a national outrage. But here in eastern Uttar Pradesh, this is an annual phenomenon. In a country like ours, where life is cheap and poor lives even more so, encephalitis is a reality and it kills. Sarah Jacob, NDTV. So is encephalitis India's most neglected medical emergency? To discuss this a little bit, we have Dr. Srivastav. He's an encephalitis activist from Gorakhpur. We have Dr. Prithu Dalaria. He heads the Japanese encephalitis portfolio at PATH, and PATH is a partner of the state and the central government to immunize against Japanese encephalitis. And lastly, we have Dr. Rajshankar Ghosh. He's a senior program officer for vaccines and immunization at the Bill and Melinda Gates Foundation. Dr. Srivastava, I want to start with you. You've been working on the ground for years. Has anything changed?
To me, in last 35 years, when the encephalitis first was visible in Gorakhpur and that area, nothing has changed. This is an apt example of indifference, neglect, and what you can say, by all shareholders, including the government. There is no proper strategy combining all the resources, combining all the departments of the government, and then to work for the single enemy, that is the encephalitis. Even after 35 years, it is not known whether it is due to JE or AES. JE, now they say that 13 to 15% cases are positive and rest are to the AES.
All right, so even as we're managing to fight JE a little bit, these new strains are coming up, and there's other things that we just have no idea about. Dr. Prithu, let me bring you in here. You know, you've heard the strong words that Dr. Srivastav had to say. You work on the ground. According to one of our reports filed at NDTV, in 2006, we had the first vaccination drive. The report suggests only 35% of the children were immunized. Next 3 years, no child got the vaccine. Then in 2010, the disease returned with a vengeance. This is what you all do on the ground. You're providing vaccines. You've been doing it since 2006. Why is there so much negative feedback about why these vaccines are not reaching?
See, it's very clear that Government of India has given clear guidelines that once you cover the entire district, the mass vaccination, cover all 1 to 15-year children in one go, and then introduce this vaccine to routine immunization, right? So what is happening in UP is that because the routine immunization cover is as such less than 50%, so every time you are leaving more than 50% children unimmunized. So this causes the built in a cohort of children which are unimmunized, right? To address this situation, we again go for mass vaccination.
Correct.
We did it in 2010. But we need to understand that doing this mass campaign is not that easy task.
No, but why? For example, we've done it for polio. What's the difference between polio and a vaccine for encephalitis?
Right. So for polio, we can use ASHA workers, we can use all health workers, because it's just 2 drops you have to give to a child. In Japanese encephalitis vaccination, we have to use the health worker who is trained, because it's injection to be given. So our human resources is limited to ANMs. So to do a mass campaign to cover one district, it takes more than 20 working days to cover entire district. So it is again very difficult to do mass campaigns. The solution is that if we improve the routine immunization, definitely we are going to reach every child, which is probably not happening in UP.
All right, Dr. Ghosh, clearly there's a challenge. It's an uphill task for the government. You work with the Gates Foundation. You donate, the foundation donates to fight Japanese encephalitis. When you look at this at a global scale, where does the India encephalitis vaccination program feature when you tabulate all your successes and your failures?
Right. So in terms of the Gates Foundation's mandate towards Japanese encephalitis, it is to save lives from Japanese encephalitis by providing safe and adequate effective vaccine, and second, to ensure that there is a proper management of the cases that come to the hospital for Japanese encephalitis. I think the Chief Medical Officer of the district pointed out very well that there are Japanese encephalitis, acute encephalitis syndrome cases, non-Japanese encephalitis, acute encephalitis syndrome cases. In terms of vaccination, I think that in India, the first coverage that was done in India in Gorakhpur districts, the UNICEF Coverage Evaluation Survey, which is an independent survey, showed that more than 70% were covered. And Dr. Dhalaria mentioned about the routine immunization, which is definitely a very poor show